The city of Pekin is one of several municipalities now suing the pharmaceutical industry, blaming it for the opioid crisis. Manufacturers, distributors, and prescribers are all accused of knowingly pushing unneeded medications for the sake of profit. Now, joining us over the phone is John Parker, a senior VP at Healthcare Distribution Alliance, which represents companies that move products from manufacturers to healthcare providers. John, none of your clients are listed in this lawsuit, but you say it does not give an accurate portrayal of the industry. Why so?
First off, I want to say, this is an incredibly difficult issue, and it's one of the most significant crises, public health crises that our country's faced in many years. But it's very, very complex, and in order to address it effectively, I think we need to have a very systemic, collaborative approach. And our view is the litigation in your community and other communities around the country, we really think it's misguided. And we don't think it's really informed by an understanding of how the pharmaceutical supply chain works and how it's regulated. And as I said, again, I think really what we need is a much more kind of thoughtful, collaborative, systemic approach to address this issue, and litigation is not the right avenue.
So what do you think can be done outside of litigation to address this current situation?
Well, and I think it's important that when you look at this issue, you really have to look at the root causes. How did we get to where we are today? Why are we facing this epidemic? And I think there's a lot of, at the very root of all this was an understanding that these medications, these prescriptions, were 20 years ago were viewed as the right way to treat pain. And so I think the medical community, was following what they believed to be the standard of care, and the appropriate approach to treat pain. And I think there were also, over the course of time, the federal government incentivized and encouraged this approach. It wasn't necessarily done because of, with bad intentions. This was fundamentally the understanding of the medical community at the time.
John, within your industry, what, if anything, is already being done to address this issue? Are there any protocols that are in place to protect people using these products?
We don't manufacture those medicines. We don't prescribe them. We don't dispense them. And we don't promote or in any way drive demand for those medications. So we have a very important role, but it's a limited role. Our role is to distribute the medicines that have been prescribed by a licensed physician and are being dispensed by a licensed pharmacy or healthcare provider. And both of those entities are also registrants of the Drug Enforcement Administration. So it's a highly regulated kind of closed distribution system. But we have, as I said, a very kind of important yet limited role in making sure that that system operates effectively.
And John, again, I know that none of your clients are involved in this lawsuit, but what kind of precedent do you think that this sets in addressing the opioid crisis?
There are a number of different things that are in place that are really beginning to have an impact that have nothing to do with litigation. And then I'd say for our industry, we have we deploy state-of-the-art technology systems. We have experts in place that are their job day in, day out is to focus on looking at and understanding the trends and the movement of product as it relates to, so we can prevent drug abuse and diversion. And I think also what we're seeing too is a desire to be more collaborative with the DEA. The DEA is the number one regulator in this area of controlled substances. And it's really important for our industry and for that federal agency to be working collaboratively, to share data, and to work in a coordinated fashion, because I think we're going to be much more successful if we're working together than if we're working at odds.
Interesting things there. Again, that's John Parker of Healthcare Distribution Alliance. If you'd like to hear more of our conversation, it will be posted later on our website at ciproud.com.